Oof.
Looks like you're getting lucky tonight.
Well, lucky in cards, but not in the bed.
Oh.
I tell the wife, you know, I buy you jewelry. I take you on vacations, exotics. I buy you new cars. I buy you furs. And all I ask for you is to come to bed with food and naked. But it doesn't work anymore. It doesn't activate my problem I have between my legs. I can't seem to get it up anymore.
Really?
And my wife's not very happy about it.
Yeah.
And she's not very supportive. How can I fix this thing so it starts working the way it used to work?
Well, have you tried the different pills?
I've been on Viagra. I've been on tadalafil. I think I'm an OD if I keep taking this stuff. I keep increasing the doses, but it just doesn't seem to work.
Yeah, that's very common. And obviously, I know you're doing all the lifestyle stuff, diet, exercise, making sure that your blood pressure is controlled. All of that's not doing the trick.
And she's not happy. She's not happy with the mechanical stuff, the dildos or the vibrators. She wants the real thing, so I have to utilize the real thing.
Yeah, I understand. So if the lifestyle modification and the medicines aren't working, next line would be to talk about things like injections. I don't know if you've ever heard of that, where people can inject a medicine directly into the penis to cause an erection. One option.
Is that before or after?
It's before sex, right? You inject.
I have to inject?
Yeah, it's a tiny needle that you would inject into.
How tiny is that needle?
It's like a diabetic needle, like, you know, the smallest needle that they make, basically.
Where do you inject this?
Into the side of the penis.
The side of the penis.
Yeah, the side of the penis.
That sounds like it might hurt.
It's so small that it's not very painful. I've never had it done, but I think most of the pain is related to the psychological aspect of injecting yourself with a needle. So a lot of people don't want to hear any more about that option. And there's other things like vacuum devices, but really once you've tried everything, the next step is penile prosthesis. I don't know if you've ever heard of that.
No, you see advertisements on TV. What is that?
So the most common type of one that we use is the inflatable penile prosthesis. Basically, with the surgery, we put this thing inside of you, and it's after the surgery all underneath your skin, so nobody would be able to tell that it was there unless you told them. And then basically, when you want to have an erection, you push on this pump that goes in your scrotum, and that pushes the fluid into the cylinders that are in your penis, and you get a rigid erection that lasts as long as you want. And then when you don't want the erection anymore, you push the other button and the fluid goes back.
So I can make this as hard and as long as I want it to be?
Well,
if I keep pumping, it will explode.
It won't get any longer than what you have naturally. So it's not a length.
Oh, I can't expand or extend.
No, it has to go inside of your penis for it to work. So during the surgery, we would measure the biggest size that fits, and we would choose that device. So it won't make you any bigger.
So what happens when it's not in use?
So you deflate it, right? Meaning all the fluid goes out of the cylinders and into the little reservoir that's hiding underneath your abdominal muscles. And your penis just looks flaccid like normal. And that's how it is for 99% of the time. It's deflated, and you could walk around the locker room naked and nobody would know it was there.
Does it affect urination or anything like that?
No, not at all.